The metallic taste of terror filled Emma's mouth as her throat began to close, her second EpiPen barely keeping death at bay. The 33-year-old had rushed to the emergency room after cross-contamination with peanuts, during what should have been a peaceful dinner with friends just 5 minutes away. Her body was betraying her again. Anaphylactic shock stealing her breath and threatening her life. The day shift team was her lifeline compassionate angels who monitored her every 15 minutes, knowing her chronic illness could send her crashing without warning. They administered medications with gentle efficiency, their caring voices a balm to her panic-stricken mind. As Emma's throat swelling slowly subsided and stability crept back into her trembling body, she felt safe in their capable hands. But when darkness fell and the night shift arrived, Emma's sanctuary transformed into a nightmare of judgment and cruelty. The new nurses brought with them an atmosphere of disdain that chilled the sterile air. When Emma's monitors screamed their warnings, the staff would let them blare until the sound became unbearable. A torturous symphony of neglect that made Emma's anxiety spike dangerously. Through her partially open door, Emma heard words that made her blood run cold. One nurse was ridiculing allergists, calling them stupid for giving allergy shots to build immunity, mocking both doctors and patients as fools. Emma's heart sank. She had been receiving those very shots for months, watching her outdoor allergies improve dramatically. The dismissal of her treatment felt like a personal attack on her journey toward healing. Then came the sound that would haunt Emma forever. Harsh yelling from a nearby room. If you weren't so fat and anxious, you wouldn't need to be in the emergency room. The nurse's voice carried venom that made Emma's stomach lurch. As someone who had fought her own brutal battle with an eating disorder, Emma felt every word like a physical blow. That patient had come seeking help, vulnerable and afraid, only to be verbally assaulted by someone sworn to heal. When Emma's assigned nurse finally entered with 2 juice boxes, the atmosphere was already poisoned with cruelty. Emma politely asked about the juice box test, the swallow study her regular doctors always performed after severe anaphylaxis to ensure she could safely swallow before discharge. The nurse's blank stare quickly morphed into something sinister. Emma watched in horror as the nurse rushed out, giggling like a schoolyard bully, gathering her coworkers to mock the crazy patient who thought she needed a juice box test. Their laughter echoed through the hallways, a chorus of professional negligence that made Emma's chest tighten with humiliation. When the doctor arrived, confused by the nurse's smirking page, Emma explained her request. He confirmed it wasn't mandatory and prepared her discharge, but the damage was done. The nurse announced loudly for all to hear that Emma was very adamant about drinking her juice in front of him, her voice dripping with theatrical mockery as her colleagues erupted in fresh waves of laughter. Emma's eyes burned with unshed tears as she gave the nurse a look that could have melted steel. Even the doctor looked uncomfortable with his staff's unprofessional behavior. The discharge nurse arrived, still chuckling, insisting, "There's no such thing as a juice box test." When Emma explained its purpose ensuring patients could swallow safely after severe throat constriction, his demeanor shifted slightly. But it was too late. The trust was shattered, the dignity destroyed. "You laughed at me," Emma said quietly, her voice steady despite her inner turmoil. "I don't want to do it now. I want to go home." As Emma gathered her belongings, she delivered words that cut through the night air like a blade. "You should be careful what you say around patients. We hear you. We see you. And now that I have all your names, I know exactly who to report when I file my grievance in the morning." The silence that followed was deafening. Emma drove home that night with her face still swollen like a chipmunk, her spirit bruised but not broken. She had survived anaphylactic shock only to be wounded by the very people meant to protect her. The irony wasn't lost on her. She came to the hospital dying from an allergic reaction and left allergic to the cruelty of her caregivers. The next morning, Emma filed her grievance with Kaiser's member services, detailing every name, every incident, every moment of unprofessional behavior. Her nutritionist supported her decision, recognizing how the trauma had triggered Emma's eating disorder recovery. Within days, case managers and supervisors were reviewing the complaint, promising accountability. Emma's story became a rallying cry for patient dignity, proving that sometimes the most dangerous allergy in a hospital isn't to peanuts, it's to compassion. What do you think? Have you experienced medical mistreatment? Should healthcare workers face consequences for mocking patients? How would you have handled this situation? Share your thoughts and experiences in the comments below.